Hello, assalamu alaikum. Welcome to Dr. OBT Live. Today, our topic is brightening cream. So this is a very hot topic, and a lot of people really like to, sometimes grill me on this topic. So let me make it very clear. I've never ever in my life endorsed a whitening cream. I don't believe in whitening. I believe in skin clarity. I believe in skin health. I believe in skin optimization. And I really believe that that an uneven skin tone or blemishes, scars, because this is the reason why I actually incorporated medical aesthetics and regenerative aesthetics in my practice. This is why I was a plastics and reconstructive surgeon, a burn surgeon. A lot of the patients who came to me had successful burn surgeries done. We did our grafting, we did all the things, but they still had problem. There was a color mismatch between the normal skin and the burnt skin or the damaged skin. So when I started doing things, I started doing chemical peels, I started giving them some nice formulas of creams which are medicated and FDA approved and clinically had scientific evidence, because whatever I'm practicing is the backing of science. When I started using them, it started becoming really popular. I started having a lot of patients coming to me in our outpatient department, and they wanted to get them skin peels and creams and laser treatments to help blend their skin. So the goal is to try your best to match the damaged or hyperpigmented or affected by melasma, any kind of things with your normal skin. So if your décolletage or your inner arm skin is much more lighter compared to your face or some areas of your face, then it's not wrong to try to make it even toned. So that's the concept, to make your skin look healthy and radiant. And usually the reason all these things are happening is obviously in burn surgeries, the burn was the trauma. But in other cases, it could be trauma due to any kind of treatment you did at home, or any wrong product you use, or eczema, or anything, or even hormonal changes which causes melasma and hyperpigmentation. So if all of these things have happened to your face, and sun exposure, of course, so you do need to help. You do need help by someone who has experience in trying to reverse and trying to kind of blend your skin tone into one. So try to make it one healthy, radiant tone. So there's no skin whitening here. There was never skin whitening. Skin brightening was always the goal, and it starts off with a variety of ingredients for topical skincare, which can help really improve it. And there's science behind it. They are tyrosinase inhibitors, and they kind of break up the pigmentation, and it happens slowly. And of course, sun protection is really important. Same way chemical peels are really effective. Same way lasers, some certain lasers, low-level lasers like Q-switch lasers or pico lasers really help to break up or shatter pigment. So a combination of these kind of treatments really works. And obviously the biggest, most popular treatment which people want to talk about is glutathione. Glutathione is basically the mother of all antioxidants. So this is a very good way to detoxify your cells, to make your skin more bright, healthier, radiant, as well as get all the other benefits of immunity boosting and overall health optimization. So it's not a skin whitener, it's a skin brightening agent. And a lot of patients also say they sleep better, they feel more energetic, they don't have as many flus, or they shorten the duration of their flus. And glutathione is used by athletes and people all over the world who really believe and focus on their wellness. And I believe that it's always not a one solution, like, oh, give me the magic cream, oh, give me the magic formula. It's always about a combination. And then some patience, because all of these treatments, even when combined, they can take some time. And as long as you adhere to the plan and understand the concept behind this, there's no reason why you can't get a good result. And lastly, I would like to add that a lot of when I started prescribing creams, when I started getting into this field, I noticed that a lot of patients used to come to me with prescriptions with certain products. And when I started investigating what's inside the ingredients and studying the ingredients, I found out that there was a lot of mercury and there was a lot of steroids in those creams. And that's what led to a lot of bad side effects, such as thinning of skin, veiny, red, flaky skin. And that happened after a long time of using those creams. And it actually, and in some cases with certain products, you can even get more reactive hyperpigmentation issues. On chronosis, you can get like this, almost like a rhino type of skin, a grayish, dark discoloration. And that is extremely difficult to treat. So be careful of what exactly you are applying on your face. And the bigger disappointment was that a lot of these people who wrote those creams were professors of dermatology, and a lot of them. So I'm not bashing anybody, and I'm just saying things as they are. And I'm not trying to offend anybody at all. I'm just telling it how it was, and this is the truth. And even to this day, if I see a prescription with that on, I kind of doubt the ethics of that person, because I really truly believe that you should be able to, if you don't believe in the treatment and you cannot advise that cream or treatment to your own relative, then you should not be giving it to anybody else. Thank you very much for today.